Hi, my name is Dr. Priya Bowery. I am an allergist based in Nairobi, Kenya. Kenya is in East Africa, and we welcome you to come and visit our beautiful country.
My name is Purity. Patricia is my friend. I've known her for the last 13 years. I used to work with her in the same organization. And even after leaving that organization, we continued being friends.
Hello, my name is Patricia Karani. I am a patient living with hereditary angioedema in Kenya.
Today I am going to talk to you a little bit about hereditary angioedema. This is a very rare condition which affects about 1 in 50,000 people, and it is a genetic condition, which means it is hereditary and runs in families. It is very rare and can cause swelling in different parts of the body, sometimes life-threatening. It can cause severe swelling in any part of the body, in the abdomen, and even life-threatening swelling of the throat. It can manifest in many different ways, but when it is life-threatening, it is a medical emergency. Treatment is available in many countries. However, in poorer parts of the world, less developed countries, modern medications are not available, unfortunately. Patients have to rely on using medicines that don't work, such as antihistamines and steroids, and sometimes just simply have to suffer and sometimes die as a result. It is such a shame that medication isn't available because of cost. There are also issues around education for doctors and lack of knowledge and poor diagnostic facilities.
I noticed something unusual and rare. Patricia would miss work. I would try to call her. She wouldn't answer. She would write a message and tell me that she's sick. And I would try to call her another day or before the end of the day, before I left work. And she would explain that she had an issue, but she wasn't able to talk so well because her voice was so down. Her voice was so low, she couldn't explain at that point. But when she came back to work, she used to explain that she had this rare condition that we didn't understand, but I came to understand. At times she would develop swellings on her hand, and even she would try to type with one hand because she's very hardworking, and I appreciate her. My boss would also persist that I call her when she's unwell because he also didn't understand what was happening. And he would tell me, "What is happening with Patricia?" He would ask me, "What is happening with Patricia?" I would calm him down and tell him, "Patricia is unwell." And that is how we were able to work with Patricia.
Stigma and discrimination is real when you have a rare condition that is unknown. I would remember times when my friends used to wonder, why am I always unwell? Is my condition infectious? And I would find friends who even ran away from me thinking that when my face is all swollen up, I might infect them. When my lips are all swollen up, I might infect them. There were times I also remember when I was so tired, I felt so fatigued from having an internal swelling, but yet I could not explain it because it was internal, and I felt so fatigued. And when I was unable to do anything, I was labeled as lazy because I could not explain what was happening internally, that I was swelling internally. These situations have affected me socially, whereby I decided to become isolated, to stay in my little cocoon, to hide myself in my room and not come out until I am well, because of the trauma associated with having to explain to people, to explain to society, to explain to doctors what I am going through.
Unfortunately, hereditary angioedema also really can affect quality of life for patients. They suffer from missed days from work, they miss school, and it really can cause other kinds of problems like mental health problems and depression. In countries like ours, there is a great stigma associated in some patients and some communities, and patients feel isolated and can be left without support. The burden of illness for HAE is very real, and we really want to raise awareness and help patients with HAE.
Rare conditions are livable with the proper support around you. People surrounding you who understand what you're going through today, what you might go through tomorrow, what you have been through in your past. So it is my hope that the more we raise awareness on these conditions, the better it will be for patients who are living like me in Kenya with a rare and life-threatening condition. I believe there is hope. There is hope for people living with hereditary angioedema. I found my hope and the light in the darkness when I came to know that I am not alone, that there are other patients out there who have formed these wonderful support systems where they are able to share without being criticized. They are able to help each other genuinely. So I found my hope in knowing that there are other patients out there, not just in my family. And by joining these groups, I learned how to be more outspoken, not to hide in my cocoon, that there was nothing wrong with me, that I can live a full life, I can live a happy life. So there is hope for patients with the right support coming from society, coming from family, coming from all those around you.